Hello and welcome, I'm Tony Wrighton, and today we're going to be discussing a problem faced by 7 in 10 people in the UK every year. It's an incredible statistic and it's a real worry for so many people. It is back pain. Well, joining me is Sash Newman, who is CEO of the charity ThermaCare, Dan Franklin, leading physiotherapist from Back in Action, and Dr. Sarah Jarvis. Sarah, you're a GP. What are some of the reasons that people come to you with back pain?
We know that there are endless numbers of causes. Dan here can give you at least 386 different muscles that are involved. But when it comes down to it, effectively, we're not meant to stand upright. These days, the problem we've got is that not only are we having to stand, but we're also spending huge amounts of our time having to hunch, having to sit, and we're not designed to do that.
Yeah, and Sasha, I just want to ask you, in terms of this whole thing of sitting down in front of computers and that kind of thing, is that a big problem as well, the fact that we're all kind of hunched over in front of our computers, and do we not sit in a very good position?
She said sitting slightly sideways on the sofa. Yes, all of those are contributory factors. But again, it's each individual person. But to sit in any one position for a long time will cause you problems. We need to keep flexible, we need to keep moving.
We've heard some of the problems and some of the causes of back pain. Let's just talk about the treatment. And Sarah, you'd be a perfect person to ask. You are a GP. I know you guys work horrendous hours. Is it sometimes the case that people in the NHS don't have enough time to devote to each individual's back pain?
Once you've had an acute episode of back pain, even though 70% of people are better within 4 weeks, 90% of people are better within 6 weeks, if you don't do something about the underlying cause, there's a very strong likelihood that you're going to end up with more episodes.
Dan, I want to ask you, as a physio, if in the first instance you get back pain, is it rest or exercise or a little bit of both that you might want to try?
You could term it active rest. You don't want to be doing things that you don't normally do, so it's not a case of getting out there and running 10 Ks if you don't normally do that. But the days of bed rest are long gone, and in fact bed rest is detrimental to your health and detrimental to your back pain. So you want to be keeping yourself as active as you would normally be. With back pain, this is a normal part of life, and in fact when you feel it, in most cases in our society, it's probably a wake-up call to actually do more, rather than do less.
We're going to look a little bit more at that now. Sarah and Dan, we're going to head over there and you're going to show us some tricks of the trade and some things we can do to help our backs. Now in a moment we're going to be talking about the correct way to lift heavy objects, but before that, Joe, you've been suffering with back pain for quite some time. Tell us exactly how it occurs and what kind of symptoms you get.
High heels are just the end of the world for my back. Also lifting, when you've got children, not just lifting children, but the rubbish and detritus they leave around the place, constantly picking up after them. Anything heavy, I have to be really careful how I pick it up.
Well, we have our resident doctor here, Dr. Sarah. You're the perfect person to ask, Sarah. Take it away. Show us exactly how to lift something heavy.
Well, you're absolutely right. So often when we lift, we don't think about it. And in fact, it's almost more of an issue when we've got things that maybe aren't quite as heavy, because then we're going to be tempted to turn around to twist and lift. And twisting and lifting is always a complete no-no. But what we're trying to do is to get absolutely straight in front of it. We used to say that all the lifting was done from your knees, from your knees, so you bent the knees only and you kept the back completely straight. What we realise now is that if you go down like that, you're actually putting so much pressure on your knees when you're coming up that you can actually do more harm than good. So now it's kind of a combination of the two. You're doing some of the bending from the knees, some of the bending from your back, but you absolutely don't bend down and lift it up like that. So the legs are going to be firmly planted, so you're giving yourself a firm base. You're quite close up to the box, and then you're going to bend quite low down like this, so that you're actually doing some of the lifting from the back, some of the lifting from the knees, and you're straight. Okay? But not like that. And don't forget, don't do it when you're putting things down either. So you're going to be going down like this as well. Right. Not down with straight legs.
Fine. Okay, so.
Bit closer up to the box. That's the one. Yeah, and right in front of it. So ideally, that's pretty good.
Yeah, it felt very comfortable.
Yeah.
Was it good on your back as well?
It's very good on my back.
Yeah.
And I could feel it sort of in other areas, which is probably quite a good thing.
Well, it's good for the buttocks.
Yeah, toning, very good. Okay.
So now
It goes
back
down
again.
in the same
Don't
way.
be tempted to bend it down that way. Because by the time you get there and halfway down and remember, it's going to be too late because you'll be putting the strain in your back already. Perfect.
Textbook. Sarah, thank you very much. Joe, very good lifting. Now we're going to bring Dan back in and show you a few exercises on how you could look after your back and strengthen it as well. Okay, Dan's back. Now, Dan, you're going to show us some exercises, and ideally, Joe would like to see a couple of exercises, some for when the back is hurting,
Sure.
and some for when it's not hurting, but just to kind of strengthen the back and the whole kind of area to make sure that you can prevent back pain from occurring.
Sounds good. If I can ask you just to lie down on the mat here. So when you're first having pain, you need to keep yourself moving, and so gentle stretches of the back are one way to do that, and also can be quite relieving in terms of your pain. So from that position, if you just take one knee up towards your chest, that's it, and just with your arms, just hug it up towards your chest, and you should get a bit of a stretch maybe in the left-hand side of your lower back. Come back down again, repeat the same on the other side. That's good, and you're just pushing into some stretch. You don't want to go into a lot of pain, you can just stretch it into a little bit of resistance. And now if you're feeling up to it, both knees. So one knee, yep, and just hugging up.
How's that feel, Joe?
It feels lovely, actually.
Yeah.
Okay, and sometimes even just a little bit of rocking side to side in that position is really quite comfortable when you're in pain.
Yeah.
Next position, if you take your legs back down again carefully. This is again for when you're suffering from pain, more so than a preventative exercise. It's not hard enough for the preventative stuff. We'll get into some harder stuff in a minute. For this one, you keep both knees together and you just rock to one side. So have your hands out maybe a little wider to give yourself some balance. And just gently taking yourself, and you can feel that twist through your spine there. We're just trying to encourage normal movement and get those muscles that are locked up to relax. So come back the other side. That's perfect. So that's just two of the exercises that I would possibly give you if you came in to see me in the clinic with a new back pain. Just take your feet apart a little bit. We're aiming for hip width and a nice comfortable knee angle. You comfortable there?
Yeah.
From here we're going to engage the stomach muscles. So I'll ask you to tighten your lower abs, keep your back still, no movement of the back, and this time you're going to float one knee up to about my hand here. Nice. Keep breathing as we do this, don't forget to breathe, very important part of exercise. This is where it starts to get hard. If you draw in through there and now lift this second leg up, excellent. Keeping it tight, drop one down at a time. I'm going to show you one more, this time more for the back side of things. Get you onto your hands and knees if you would please. Great. To do this exercise, we want to keep your spine in what we call neutral. Now, Joe is particularly good at finding neutral, that's perfect. For those of you at home, what you want to do is to arch your back. So arch up as if you were a camel. Good. And now come right down as if you were a cat stretching. Keep going, good. Now I want you to find somewhere in between the two. So coming back up, and that would be a neutral. That's perfect. Okay, from there, what I want you to do, again, drawing your abs in, because they're key to back health. I want you just to float one arm out in front of you. Perfect, and you're trying to keep yourself as stable as you can. Imagine you've got a coffee mug on here and you're trying to keep yourself as still as you can. And come back under. Good. Keeping your stomach in. This time take one leg out behind you. Good.
That looks quite hard work. Joe, how are you finding it?
No, it's fine actually, no problem.
Now, if, like Joe, you're finding this quite easy, you can make it harder again, of course.
Ah, you said it was a trick question.
Bring the knee back under. There's always something harder with a physio.
Yeah.
From here, again, tighten through your stomach. This time I'm going to get you to lift this arm up, and now with the opposite leg, float that out the back. And obviously this is a much more difficult balance act. Joe's making it look easy, but this isn't easy. Just tuck your chin in there, Joe, so you're keeping yourself nice and neutral. And come back in. And obviously you repeat this on the other side, and you would be able to hold it for longer and longer periods and more stable as you get better.
And presumably that's providing a kind of stretch at the same time.
There's not a strong stretch in this position, it's more muscles. So it'll be back muscles working, it'll be glute muscles working, shoulder muscles working, and because we've asked Joe to hold her stomach in, the stomach and core working as well.
Joe, Thank you very much. You've been a wonderful subject. And you said, I like the way you said that you weren't finding that, you didn't find that too bad on those?
No, I didn't. It was fine. There was no back pain with it at all, so that was great.
And in fact, some of the exercises you did earlier, did they feel good on the back as well?
Yeah, they all felt very reasonable, especially some of the rolling and the stretching movement. Where I do get low back pain, that's exactly, that stretch feels so comfortable and so nice to do.
Great. Joe, you've got some good exercises to work with. Dan, thanks very much. There'll be lots of people watching this and nodding their heads and saying, absolutely, I recognise all these things that you're talking about. I mean, perhaps asking each of you for a few short tips that you'd give for people to prevent back pain from getting any worse or prevent it coming in the first place if you're lucky enough not to have any. Starting with you, Sash, what would you say?
I guess one of the most important things is stay as active as you possibly can.
And being active, Dan, what sports are good for us? I'm a very keen golfer. Is that good for me on my back to play golf?
It depends on your technique. Almost every sport depends on the technique. So.
You almost sound like a doctor failing to make a decision.
Yeah, or either that or he's seen my golf swing, one or the other, yeah.
I mean, one of the most common sports that are prescribed is swimming for people with low back pain. Swimming has the benefits of being non-weight bearing. However, it's not the only thing, and I think that often swimming is almost over-prescribed. It's just easy to say, why don't you swim? And some people haven't swum for 20 years. Yeah. Their technique is atrocious. They're putting their spine into all sorts of horrible positions, and swimming, you know, they come to me and they say, trying swimming is not very comfortable, and have a look at them in the pool and it's not surprising why that is.
We've got swimming and we've got walking. I want to ask you about cycling very quickly, Sarah, because I know that you cycle from London to Paris.
I did.
Why?
Goodness knows why. No, very. And how was your
Most
back?
incredible feeling. Well, do you know what? It was my single biggest worry, and I did use a heat back wrap. So I put it on that night, and the next day I was absolutely perfect, and I wore another one the next day, and then the third day I
you
thought,
wore one while you were cycling, absolutely fine.
Absolutely fine, absolutely fine. It was fantastic. It was the most amazing feeling.
Joe, tell me a little bit more about your back pain and when you first noticed yourself getting back pain.
I think it was probably my late 20s, and I have to say that it was almost certainly because of wearing high heels for too long, standing up in high heels, parties, walking around shopping with high heels on.
Now, someone who hasn't worn high heels that much, just explain to me exactly what that does to your back.
For me personally, I get a lot of lower back pain, sort of dull back pain, and then it came on again when I was pregnant with my first child. I started to notice it.
But you have found something that does help with this backache, because I mean, you know, this thing that affects 7 out of 10 people, anything that helps is a good thing, right?
Absolutely.
Yeah.
And I came across this ThermaCare, their back wraps, which are heated back wraps, and they are just great. They are really, truly, I can put one on, it'll start working, I can start to feel the heat, and as my back warms up, I can feel the muscles start to relax and the pain subsides with it. And what I like about it is that once you've put one on, it'll last for hours, that heat. So then you can go about, and because of the way it looks, I'll just show you what it actually looks like. So it comes in its own separate pack, present for you, and it opens up, and this particular one, you can see it's like a, that's what it looks like there, and you put the dark side, and as soon as you start to take it out of the pack, it starts to heat up. It will take a few minutes to actually get warm, and it doesn't get boiling hot, it's just pleasantly, comfortably warm. So that as soon as I start to feel achy, or I can feel that, or I've done, or even if I know that I'm going to do sort of breaking up the leaves or whatever, I know I'm going to do it, I might well put one on.
And when you have it on your back, it's just a nice feeling, walking around, doing whatever you do anyway.
Well, you can see how flat and small it is, and obviously it's stretchy, so it's very comfortable to wear. You can wear this comfortably all day. I mean, if I was going shopping, Christmas shopping, whatever, all day, then I would probably put one on before I went.
Well, I want to see how it works.
Okay, you just literally strap it on. So it obviously should go against the skin, but obviously from everybody's slightly different. But you can see it's got a stretch, so you can pull it as tightly as you like, and it just connects around itself. So if I just turn around here, you can just see from the back, then it would go just against your skin or the skin of your back, and you can position it pretty much wherever you like, because for me, I get a lot of right-hand side back pain, but obviously it's so adjustable. You can put it wherever you like,
Yeah.
in terms of.
So are you feeling that? Are you feeling that now already?
It's lovely. It's
Is it hot
lovely.
already?
So it's not hot. It's starting to get warm.
Yeah,
It's starting to get warm.
Okay. How long would you wear it on a day?
I could keep it on for 8 hours, practically all day, really. For me, it's having this at hand. I know I've got them at home. Rather than taking lots of sort of paracetamol or things like that, I can try this first and see how that helps, and it does help. every time.
And where can you get them from?
They're really easily available. You can get them from any sort of chemist, pharmacy. When I went on holiday, I was down in Cornwall, didn't take enough with me, so I got one down there, so it was easy.
So you've got that, you've got your exercises, you've got your stretching, you're sorted.
I am.
We've talked so much about how, natural prevention is absolutely ideal, but sometimes I suppose people do need painkillers, am I right? Yeah.
People who get chronic daily headaches, for instance, the vast majority of them are people who have those headaches because they have been taking painkillers too often. But we're talking about people who've got acute problems. And for
We will
acute
say
problems,
take them for 3-4 days. If it doesn't go, point straight to the GP.
people who've got chronic back pain, they are looking at complementary therapies as one of the options.
One of the points from back care is the professions all working in their own individual ways and not communicating. So if you go to an osteopath and it doesn't quite work for whatever your expectations are, you go to a physiotherapy. So the physiotherapist sees only the osteopath's problems. And in general, they tend to be dismissive about each other. What we're trying to do is bring everyone together.
Well, I'd like to thank all my guests for coming in today. Joe, thank you very much indeed. I'd also like to say thank you to Sash Newman, CEO of the charity Back Care, Dan Franklin from Back in Action, and Dr. Sarah Jarvis. Thank you all very much indeed.